So the third and final question that people often ask is my pain going to get better?
You're asking all the easy questions this afternoon, Sarah. So, I'm going to be really careful with my response around that, and I'm going to answer your question maybe by not answering it and saying maybe, but maybe not. I think, what we've spoken about today is pain is perhaps more complex than people often think. And complex problems rarely have simple solutions. And I think a difficult message sometimes for me to have to explore with people with pain is that we may not have that quick fix, that cure, that thing that we can do to you that's going to take the pain away. If we did, we wouldn't have these situations we have with chronic pain, and I wouldn't be in the job that I'm in. So I think to really kind of think about, will my pain change? It's really trying to think about that kind of impact that pain has on us, and we can really think about that in terms of the physical body, if you like, and the physical changes that happen when we have ongoing pain. But we can also think about the kind of the impact it has on us from our emotional well-being, and our thoughts and our feelings. And what's really, really important is recognizing that, we're dealing with people who are experiencing pain, and people have different values in life, and pain gets in the way of that. So we'll be thinking about how pain impacts our role in our family life, our work, perhaps our interests, what's important to us. And I think, we can understand that pain can influence those things, but what we've grown to understand is it's not a one-way road, and that all of those different factors will influence our pain as well. And to add an extra layer of complexity, those different factors influence each other. So for example, if you have a chronic pain condition, and that affects how you do your job, that might keep you awake at night. You're worrying about your finances, and it's making you feel quite stressed and low in mood. And we know all of those factors will certainly increase your likelihood of experiencing pain. It will also affect how you experience pain, and how you cope with it as well. So pain, we use this word biopsychosocial. I think it's possibly something you'll talk about on the course, and we're thinking about the body, thinking about the psychology of pain, our thoughts or emotions, and the social aspect, what's important to us. And it's really only by taking a step back perhaps and trying to look at that big picture, that person as a whole, that will have any chance of having perhaps a better outcome. Whilst we're trying to rely on things that solely focus on the body part, then we're going to be pretty limited. And
so there are lots of factors that can influence whether someone's pain might stay the same or get worse or get better. It's not just what's going on in their body.
Absolutely. And it's coming back to that idea of not just the body, but thinking about the nervous system and the brain. Because if we only focus on any one part of that, then we're not going to get a complete picture, we're not going to understand the situation, and we're probably not going to be empowered to take control over it. And I think, coming back to that idea that we touched on earlier about how pain can vary so much from day to day, and how pain can move around, and how that system, sensitivity, can change, and all those different factors that we touched on can change the sensitivity of the system and change our pain experience. So what I mean by that is, things like if we're pushing into pain, or we're trying to avoid it and we're not doing very much at all, or if we're really anxious and worried and stressed, or we're not sleeping very well, all of these different factors can potentially turn the volume up on our kind of nervous system, if you like, and can change our pain experience. And I think the challenge is to try and understand that big picture and maybe try and explore ways to see if we can perhaps turn the sensitivity of the system down. Can't turn it off, but maybe we can indirectly kind of change that.
So a lot of those factors that you just mentioned, actually, those are the things that we know pain can really impact. So things like sleep and relationships and work and stress levels and mood. And so those are the things that we really focus on the programme. So as you said, people often can't reduce their pain through injections or other medical interventions. But we do know that if we focus on the areas of life that have been impacted by their pain and we help them to improve those, then their quality of life overall improves anyway, even though the pain is still there. So in our online programme, in the same way as we would in a face-to-face programme, we're going to have sessions on sleep, on managing difficult thoughts and feelings, on managing times of worse pain or flare-ups. We'll think about activity levels, building up activity, and all sorts of other things which just fit with that overall idea of the pain may still be there, but we are helping you to get your life back to where you would like it to be.
Yeah, that sounds really great and a really helpful approach. And I think it's really important as well for patients with persisting pain to be realistic as well. I feel I kind of come across some with all the bad messages sometimes, but I think it is really important to be very kind of open and transparent about what we know about pain. And we know that the longer that pain persists for, the more kind of adaptations that happen in the body and the nervous system, and the harder it can be to change. So, you know, it sounds really interesting what you were talking around then, and for some people shifting the focus away from trying to find a fix or a cure, which may not really be there, unfortunately, and moving more towards accepting pain, and really trying to think about, okay, how can I improve my quality of life living with pain? And that can be, for some people, a lot more helpful and rewarding in the longer run.
Okay, thank you, Chris.
No problem.
Any take-home messages before we finish?
Oh wow, take-home messages. Yeah, I think if I were to give a few kind of little kind of take-home messages, I'd be saying pain is real. I think too often, and sadly, I hear of patients who feel they're not believed, and I would really put across that, you know, pain is a real experience regardless of the cause. Pain is all about protection, and that idea that pain is an indicator of damage or harm in the body, unfortunately, you know, we've learned a lot since then, and that's not always the case. Pain is complicated, and I think learning about pain is really, really important. As we mentioned at the beginning, you know, to understand the problem puts us in a much better position to try and find a more helpful kind of approach to move forwards, really. And I would say, you know, it's about taking a different perspective, a different journey, and really embracing that biopsychosocial approach. You know, if we change nothing will change.
Great, thank you, Chris.
Yeah, no worries.